Victor Black.
Victor Black.
Uncle Victor.
Victor Black Masterclasses.
Mr. Victor Black.
Virtual Victor, the safer use model.
Understanding risk and long-term consequences. When we talk about risk, we start at the highest level. The greatest risk of PED use is reduced lifespan and diminished quality of life. Deaths in the bodybuilding community are not rare. This is an uncomfortable reality. It is easy to dismiss these cases by focusing on extreme dosages. However, fatalities have occurred at moderate and seemingly conservative levels. Genetic predisposition plays a role. Do not assume you are exempt from these risks. The most common finding in autopsy reports is cardiovascular disease. This is consistently associated with anabolic steroid use. Heavy PED use increased significantly in the 1990s and 2000s. The long-term outcomes of that cohort are still unknown. Many heavy users are only now reaching middle age. We do not yet know how many will reach older age. This uncertainty itself represents risk. The data simply does not exist yet. Evidence, duration, and dose accumulation. Retrospective data show higher mortality in anabolic steroid users compared to non-users. These studies show association, not causation. Confounding factors exist in all observational data. However, a threefold increase in mortality risk is meaningful. Risk increases with cumulative exposure over time. Longer use correlates with higher mortality rates. This is why an exit strategy matters. The goal is not indefinite use. Risk is driven by both dose and duration. High dose for short periods and low dose for long periods both accumulate risk. There is no risk-free pattern of long-term exposure. Total burden is what matters. While PEDs produce anabolic and androgenic benefits, supraphysiological dosing introduces systemic harm, organ system risks, and health impact. The brain is a major concern. High-dose androgen exposure is neurotoxic. Mood instability, aggression, and depression may occur. Long-term risk may include cognitive decline. Cardiovascular effects are the leading cause of death. These include left ventricular hypertrophy, hypertension, and atherosclerosis. Blood thickening increases clot risk. This raises the likelihood of stroke and embolism. Liver stress is common, especially with oral compounds. Cases of hepatic cancer have been reported. Musculoskeletal injuries increase as strength outpaces tissue resilience. Tendon rupture and chronic injury become more likely. Kidney stress can progress to renal failure. In severe cases, dialysis or transplant may be required. Reproductive suppression occurs in both sexes. Infertility and sexual dysfunction are common risks. In females, virilization is a major concern. Many changes are irreversible. Menstrual dysfunction, bone density loss, and organ stress may occur. Risk increases with higher muscularity demands. Monitoring, prevention, and risk management. Risk awareness enables prevention. Monitoring exists to detect problems before damage occurs. Lab testing and urinalysis should be performed every 10 to 12 weeks. This provides early warning signals. Annual echocardiograms are recommended. The heart is the primary organ at risk. Cardiac calcium scoring may be performed periodically. This helps identify arterial plaque progression. Blood pressure should be monitored weekly. Hypertension often presents without symptoms. Blood glucose monitoring may be appropriate for some athletes. Insulin resistance contributes to long-term disease. Female athletes should undergo yearly gynecological exams. Ovulatory menstrual cycles are a key health indicator. Side effects should be actively tracked. Changes in voice, skin, hair, and reproductive health must be documented. Dose and duration are the primary drivers of risk. Anabolic steroids carry the greatest burden. A step-based escalation approach is essential. Use the lowest effective dose to achieve the goal. Risk should only increase when progress demands it. More exposure always means more risk. The objective is longevity within the sport. Staying healthy allows progress to continue over time.
Victor Black.
Victor Black.
Uncle Victor.
Victor Black Masterclasses.
Mr. Victor Black.
Virtual Victor, the safer use model.